To get a sense of what it's like now in hospitals, both for patients and for medical professionals, I want to bring in two specialists. In Edmonton, Dr. Aisha Mirza is an emergency room physician, and in Saskatoon, Dr. Hassan Masri is an ICU physician. Thank you both for taking the time for us today. Dr. Mirza, I want to start with you. We just quoted some of that letter put out by the Alberta Medical Association. Many say it's a healthcare system on the verge of collapse. What are you seeing in your ER?
Thanks for having me today. That tweet really hit home, hearing that, because I'm sure I've heard those exact statements from patients in the ER that I'm seeing come in. That letter is a really important one. When I see our government asking for federal help, when I see them asking for other beds, ICU beds in other provinces for Albertans, when last week we had a province-wide emergency education on critical care triage, which in 15 years of emergency medicine, I've never had to sit through. All I can think is our leaders are trying to pour water in a bucket with a hole in it. And that's not enough. We have some of the weakest public health safety measures Canada-wide right now in Alberta. And that's not okay. I'm really worried about Albertans. I'm worried about Albertans having access to the surgeries they need. And personally, having to tell patients, well, normally you would have surgery for this, but since we don't have access to that, these are some things that you can do in the meantime, and we hope that things don't get imminently worse for you. And I can't even imagine what those conversations are going like for my surgical colleagues who are in that same boat. They know treatment A, this particular surgery, is in the best interest of the patient, but they actually cannot deliver it in Alberta. And so they're left with treatment B and hoping for the best. That's not okay. Albertans shouldn't be okay with that. I'm hearing my nursing colleagues share with me their horror stories of verbal abuse, the stress that they're under, being forced into situations that they don't want to be in, being diverted to areas that they don't have expertise in. I'm hearing about my nursing colleagues who've gone from the ER to the ICU, where the standard of care should be one-on-one care with the nurse, and instead there's one-on-two, in some cases maybe one-on-three, and I just think this isn't the standard of care, and we're going to lose knowledgeable, experienced nurses, putting them in this situation. Nursing is the backbone of delivering medical care, and we need to protect our nurses.
Dr. Masri, can you describe for me the strain COVID has put on you and your colleagues in ICUs in Saskatchewan?
The story is very similar. Unfortunately, the fourth wave in Saskatchewan and Alberta looks very similar. If we look at the provinces next door, whether it is BC or Manitoba, the fourth wave looks very, very different. And the reason why the fourth wave looks almost identical in Saskatchewan and Alberta is because of the public health measures. We know that public health measures work and work very well. We know that mandating vaccines work and work very well. And fortunately, those two provinces and their governments did not do the right thing over the summer. The situation in our hospital is no different. We have almost over 200 procedures and 50 surgeries or so are being canceled every single day here in Saskatchewan. These are, as she mentioned, are life-saving procedures. We're not talking about replacing a hip or a knee. We're talking about cancer screening. We're talking about cardiac catheterization. All these procedures are canceled. The strain and is palpable as the moment you enter the hospital. Our ICU capacity has increased. We are in surge capacity, but even that is being pushed to the limit, and the situation is quite dire. We are now very close to a situation where we will need extra help, and we will be in a position where we have to make life and death decisions based on a triage system. And again, I didn't think that I would ever think of a triage system in Canada. Usually this is a system, literally is a military-based system based on limited resources in a war zone. And to think that in a large city like Saskatoon or Regina, we would have to resort to that is quite problematic. Our ICU is full. It is almost entirely full of COVID patients, and I would say almost all of them are unvaccinated. And we really need to do a better job, especially as a government, to save the citizens of our province and not put them in this position where they are languishing and are out of breath in a hospital bed, alone, unable to be with anyone, and it's a very, very serious situation.
And Dr. Mirza, triage protocols for Alberta doctors, it seems inevitable. Maybe the province isn't officially implementing triage protocols, but don't you already feel as though you're making some life and death decision, or your colleagues are making life and death decisions, whether you're there officially or not? Doesn't it feel like you're at a system or in a hospital that's breaking?
Anytime you see a patient that is not getting the standard of care, you know the system is broken. And I'm seeing that every shift. Every shift, I'm being forced to tell a patient, whether it's because the fracture can't be appropriately reduced in the ER, that they don't also have access to surgery at this time, that's going to be delayed, from something like that to what he was saying with regards to cancer surgeries and neurosurgeries. These are important surgeries that patients are not getting, and I don't have any answers for them. I already feel like I'm in a situation where patients are truly suffering. And it's not just unvaccinated patients who are suffering, it's vaccinated patients who are suffering. It's everybody. And I really hate that whole dichotomy of vaccinated versus unvaccinated to a certain extent, because it's all of Albertans right now who are suffering. And the public health measures that we're asking to be put in place at this point are to help that surge of ICU beds and to help all Albertans. I'm worried about my children. My youngest is 11, and I'm thankful that my local school is doing the best that they can, but we don't have province-wide support and funding placed with a school plan to protect our children. I want better air ventilation. I want them to have smaller class sizes. I want them to have universal masking. I want access to vaccines in the schools so that we can break down barriers to access.
And Dr. Mirza, I think what you're saying is, like, it's not just about, when you say you don't like the dichotomy between vaccinated and unvaccinated, you're saying that there are a lot of people that are coming to the hospital that need to be attended to for things non-related to COVID, for cancer, for heart disease, for maybe they were in an accident and they end up in your ER, and it's those people that you're concerned about, right? In terms of, like, what if there were a big pileup on the highway outside of Edmonton right now? I mean, it just feels as though you might not be able to give people the care that they would normally get.
That's my worry every time I show up to a shift. I want to take care of everyone who's critically ill. I don't care whether they're vaccinated or not. But I want to be able to know that there is a bed available for everyone that comes in who's critically ill. And I'm not sure that I can promise that if we continue on the path that we are in Alberta.
Dr. Masri, what needs to happen? What needs to happen to kind of ease the strain in hospitals in Saskatchewan and Alberta and ease the workload on you, the frontline workers?
What we need to happen right away is what we did successfully in all provinces and really in all countries all over the world previously when we had a unprecedented surge. So first of all, in Saskatchewan, finally, we have masking back on. But it's not really being enforced in the way that I would like to see, and mandating anything without enforcing it does not, make these laws be taken very seriously. So the first thing is we really need to make sure that the mandated masking is being enforced. And we need to have universal masking in schools. Number two, we know that spread is happening indoor, and especially in places where there is a significant amount of interactions, oftentimes unmasked. Those places are bars, clubs, and places of worship. And I think that we really need to go back to closing a lot of these places early, for example, bars and clubs, and limiting capacity in places of worship and making sure that masking is enforced. The third thing is the government in Saskatchewan here, for example, finally mandated that its employees be vaccinated. But otherwise, no one else is mandated to be vaccinated. And we need to extend that to every single healthcare worker and everyone who's involved in education to start with. These account for a huge percentage of people here in Saskatchewan, and the people who are in school or in the hospital are very vulnerable. Whether in school it's under 12, they're unvaccinated, and people in the hospital are obviously very vulnerable. So we need to mandate vaccination there. The other thing is in sport events, for example, a Riders game, we cannot have 35,000 people gather together without a strong enforcement of the rules. Currently, you could enter a Riders game with a proof of vaccinations or a negative test. Negative test is not a good way to go, because as long as it's negative in the last 72 hours, you are okay to enter, but that doesn't mean you're negative after you did your test. So we really need to have enforcement of vaccine passport and vaccine record. These things cannot happen 3 weeks from now or 4 weeks from now. They need to happen right away, especially the first two issues. Vaccines are going to help, but they're not going to flatten our line in the next 10 days. They're going to take a long time to work, and we really need to enforce the other things that I mentioned immediately. Triaging is taking place, whether it's officially being declared or not. When you delay, a procedure like a colonoscopy to detect cancer and resect it, you are officially in triage for that patient, and there is no way to deny that.
Dr. Mirza, you both have a chance to deliver a message to the public, to decision makers. What is the message that you want to say?
I think when we look back on this moment on history, we're going to know that this was a crossroads. And I think our government has a chance to immediately make some province-wide funding, support, guidelines, mandates that actually make a difference moving forward. I don't think we can put our blinders on, raise up our hands and say, I don't think that's what a government is supposed to do, and say, well, we'll see what happens, because that's what I feel like is happening right now, and that's not okay. I agree with everything that was just said. I think mandates need to be placed. I think we need contact tracing back. We need to do a better job.
Dr. Masri?
Well, first of all, I think that the government needs to understand that we're all on the same team. This is not the government versus the medical community. We need to be able to see the modeling data that the government of Saskatchewan has decided not to share with the medical community. So we could share, it has to be shared with the public, because when people see what the modeling is suggesting, I do believe that people will change their behavior. We need to make very serious decisions. We cannot fight COVID with slogans like open for summer. We need to fight COVID with science and data. And if we truly want to save the citizens of our province and have the economy open and protect the social life of the citizens and the children of the province of Saskatchewan, then we need to understand that these public measures and mandating these vaccines are going to be the best way to keep the lives and the economy going. Anything else will result in a very ugly fourth wave that we're seeing. And unfortunately, Saskatchewan and Alberta share more together because of the lack of these public measures versus, for example, British Columbia or Manitoba, where things are significantly better. In Saskatchewan, almost 1 in 250 people have active COVID right now. This is a number that we should not, as physicians and as a government, accept for ourselves, and things need to change immediately. Otherwise, truthfully, in a week from now, we will be in a position where triage will be enacted, and we could have prevented it in the first place.
Dr. Mirza, just a quick final word to you. You know, when just getting back to that tweet, that awful tweet of somebody who knew he was going to die, what is your message to people out there who are not vaccinated, who, for whatever reason, what do you want to say to them?
I want to ask them to make an appointment with their family doctor to have a discussion about whether they should get the vaccine. And I hope that they trust the information that is given to them by someone who they've trusted up until the pandemic to take care of them and their family, because they need to not listen to the misinformation out there. And unfortunately, there's always going to be YouTube videos from this person and that person that tell you or try to scare you against the vaccine. Beyond that, I do think that there's a responsibility on the government to outreach specifically to certain pockets of the community that are not hearing the message that they need to hear. We need to try to stop what those barriers are, whether those barriers are that maybe people are in different homes and separated and they have different thought process on it, whether it's a socioeconomic barrier because people are busy working and just feel like they don't have the time to do this, then maybe we need to have vaccines available where it's easier for Albertans to access. I think that responsibility is on both the Albertan and the Albertan government.
I want to thank you both very much for taking the time. Thank you. That is in Saskatoon, Dr. Hassan Masri, and in Edmonton, Dr. Aisha Mirza.